And with vaccine eligibility expanding this week, we know a lot of you have questions about the vaccines.
Dr. Dean Blumberg has been with us since the beginning of the COVID pandemic. He's a pediatric infectious disease specialist from UC Davis Health, and he is joining us live now to answer some of your questions. So good to see you, doctor. And let's talk about this Johnson & Johnson being put on hold today. What does that mean for all of us?
Well, it means one less arrow in our quiver, really, because that's one less vaccine we have, and that impacts our vaccine supply also. And remember also the Johnson & Johnson vaccine had some advantages compared to the other vaccines in that it was only one dose, it was easier to store, easier to transport, and so it was really an advantage for those who may not seek health care so much, such as those who are homebound or homeless.
So, Dr. Blumberg, people who got the Johnson & Johnson vaccine in the past week, should they be concerned, or maybe people who already got it even more than a week ago?
Yeah, so the Johnson & Johnson vaccine, the side effects that have been seen, this very rare side effect, it's really rare. It's less than 1 in a million of the Johnson & Johnson doses. All of these events have been between 5 and 16 days post-vaccination. So the CDC and others are recommending to be vigilant, keep an eye on things within the first 3 weeks after vaccination. If you experience severe headache, severe leg pain, shortness of breath, or abdominal pain, then you should seek medical care. And there's a lot of publicity on this so that doctors should know the next steps and what to do.
So we've heard a lot about some of the more mild side effects that people have experienced after getting the shot. And one of our viewers was wondering, what if you don't have any kind of reaction? Could that mean that the vaccine is any less effective for you?
Yeah, I think the message has gotten out that that's wrong, which says that if you experience a lot of side effects, that's normal, and that just means that your body is forming immunity. But then the corollary to that is, if you have mild symptoms, does that mean you're not forming immunity? And so I've heard people be concerned about that, and that's just not true. Remember, in the vaccine trials, about half the people had some side effects and half didn't, but the vaccines protect about 90 to 95%. So clearly those who don't have significant side effects are also protected.
Are there differences in the side effects depending on what vaccine you get?
There's slight differences in that there's more reactions after the second dose compared to the first. And of course, the Johnson & Johnson is just a one dose. So then you don't have that second dose and you don't have those more significant reactions.
And Dr. Blumberg, we know that the Pfizer and Moderna vaccines are 2 doses. So that one of our viewers wanted to know, if you get your second shot a little bit later than what you're supposed to get, is that okay?
That's perfectly fine. The CDC recommends trying to get your second dose on time, and if not, within 6 weeks of your first dose. But if it's delayed longer than 6 weeks, you don't have to restart the vaccine series. You never have to do that. And in fact, a longer interval in between doses does result in better immune responses with other vaccines. So we expect the same with these vaccines.
That's interesting.
Okay.
What about, are there any special recommendations for women who are pregnant or maybe breastfeeding?
Yeah, so we know that that COVID during pregnancy is more severe than women who aren't pregnant of the same age. There's a higher risk of hospitalization, ICU admission, and needing to be put on the ventilator. So we are really concerned about that, and we also worry about COVID inducing preterm delivery. So if women should talk with their doctors about this, but I've been recommending it during pregnancy. I think it's safe. I haven't seen any concerns about side effects during pregnancy. There's more than 86,000 women who've been reported to receive the vaccine in the US while pregnant, and over 4,400 of those have been studied very closely by the CDC. There's been no signals about adverse outcomes for birth. So same with breastfeeding. The vaccine should not be in breast milk. The mother who's vaccinated will get antibodies, and those antibodies then are detectable in breast milk and are passed on to the breastfeeding child and should help protect them.
Dr. Blumberg, are you concerned with this latest halt on the J&J vaccine, that this might affect other people maybe not wanting to get any vaccine at all, since there's been such a big push to get people to get vaccinated, especially people that have maybe been hesitant to do so?
Yeah, I am concerned about that, but I've been really pleased with the way the message has been rolling out, which is basically this shows that our vaccine safety system works. It's able to pick up these very rare side effects. It's only 1 in a million doses. It's clear that the benefits of vaccination outweigh these very small risks that are occurring, and the risk of this similar type episode of the low platelets and the possible strokes that may occur, it's much higher with other medications such as birth control pills, such as oral contraceptives. So if you put this into perspective, these vaccines are still very safe, but it is appropriate still to pause vaccination while the CDC and the FDA and others gather more data.
And I know that there's testing going on in terms of vaccinating children. What are your thoughts on vaccinating children?
Yeah, well, we need children to be immunized for several reasons. One is we want to prevent them from getting COVID, and although they generally tolerate infection better than adults, I have seen children hospitalized with COVID pneumonia. I've seen them in the ICU on ventilators. And then children also get the post-COVID, the multi-system inflammatory syndrome in children, and those children can be very sick. So for their own sakes, children should be immunized. And then children are members of our community. So if we're going to achieve any kind of level of immunity in our communities, herd immunity, then we need to make sure that children who make up a significant portion of the population, that they're immune too.
All right, Dr. Dean Blumberg, again, you've been with us since the beginning of the COVID pandemic, answering a lot of questions for us over that time. We appreciate it. Thanks so much for your expertise again today.